Hello. So today I'll be discussing about the social work podcast on psychopharma uh, therapy in my psychopathology course in clinical social work. So today the first question said, there seems to be a divide among social workers as to how much we should discuss medication with our patients/clients. Where do you, myself, come down on this issue? How might you address it in your practice? Well, as for the divide among the social workers, which I heard in the podcast with the medications, patients is due to be, in order for me as a social worker to be a better social worker, being more responsive to the clients and being passionate towards the clients as well. Also, in this aspect, this comes down to, of course, what I just said, being responsive towards my clients and whatnot, and also knowing their needs when it comes to their needs with their families as well, and in partnership with the clients as well. As for the use of the medications, just particularly in mental health. As to where I come down to this, I would have to say I would be able to apply my social work skills with the clients who are dealing with these medications, but also learning what I can do as a better social worker. So where do I come down on this issue? Well, as I just stated before, I just want to be a better social worker, be more compassionate towards my clients. A lot of people tend to be very rude towards clients, which is not our job. And if we don't do our job, then we're not even letting the client down, but we're letting ourselves down and our agency down. How might you address it in their practice? I would mainly address it in a more calmer way towards my clients, but mainly talking it towards to my supervisors about, hey, something isn't going right with these medications, and just talking verbally with the important people I'm dealing with, which is mainly my clients and my supervisors and other people in my agencies. The second question is, what is your plan, my plan, to stay aware of the psychotropic medications when you are a professional social worker? As to my interest, for my plans is staying aware of the psychotropic medications when I am a professional social worker, is being, of course, you being able to use my basic social work skills, whereas being ethical with the medications, even though we don't prescribe medications. We can still talk about the medications, but we can't just prescribe them how psychiatrists or even primary doctors can't do that. But we can still discuss what medications, and we can make suggestions to the client. I also want to be an advocate for my clients' choices. If they want to take the medication or not, I'll still be very supportive of that. But still making suggestions if the client wants to see good outcomes and results. As I said in the end of the podcast, it did discuss being compassionate towards my clients and planning what's next for the client, having a partnership with the client, of course, being an advocate as well, and what types of teams I'll be dealing with towards getting help with that. It could be any type of team that I'll be working with. But specifically, I would have to say in this field that we're talking about is the treatment plan, and just being a better communicator and also a better listener towards my treatment team as well as towards my clients. So, thank you for watching my video.